Well, I want to thank each and everyone for being here today. Um, I think I know everyone on this call, and so today it's about the Unified Health Simplified webinar. And my name is Dr. Bart, and board certified plastic and reconstructive surgeon. And my personal mission is to lovingly disrupt the current healthcare model by delivering a democratized and unified model where every stakeholder has a seat at the table and wins. And so, what is this really all about? Why unified health simplified? In today's world, we actually live in a very interesting time when it comes to healthcare. And when we look at the United States, of all the other 11 industrialized countries, we spend twice as much as any other country on healthcare, yet we rank last in efficacy and the delivery of care and the quality of healthcare, which is quite bizarre. And we're spending at least 1/5, of our GDP on healthcare, which is insane. And since the 1950s, what's been happening is that the incidence of chronic illness has skyrocketed and is quite getting out of control. And in today's world, we are short of doctors. In fact, prediction is that by 2034, we will be short of 100,000 doctors. And so, why is this, all relevant today? Because over the last 200 years, how medicine has evolved, particularly at the turn of the last century, how it's evolved in the United States, had been predominantly focused on a very limited area of health optimized. So the idea was, with the Carnegie Institute, the Flexner report back in the 1900s, pretty much washed out everything that was not academic medicine, drugs, or surgeon. And so, whilst prior to the turn of the century, Sears Robot was actually selling all sorts of medical devices and electronic devices or electric devices. And there were at least 10,000 doctors throughout the United States that were buying Sears Robot devices, and all that was washed out. Chiropractors were washed out. Everything else was pretty much washed out. And then if you fast forward to where we are today, it's really quite a dysfunctional state on so many different levels. And as doctors have become even more specialized, they've become also much more myopic in all their endeavors to help people. And therein has become the real issue in today's world, is that the doctors today are not really optimized to help patients with certainly the amount of information that is currently available, and the inability to actually manage all of that and a lot of other things. And so the challenge that we have today is that doctors are struggling. We have this skyrocketing rates of PTSD, depression, burnout, even suicide, and many doctors are actually quitting or changing careers. So that becomes a major problem because, who's actually going to be taking care of us? Whether the boomer generation or a later generation, which are the doctors that will be taking care of you, in addition to the fact that the standards of becoming a doctor are also decreasing. And that's a story for another day. So the purpose of this webinar is really helping doctors, and this has been my mission over the last 22 years, is as I understood, what was very predictable and preventable in the area of healthcare, is how disconnected this and dysfunctional and marginalized it all is. And so my mission started about 20 years ago to develop programs by which the consumer had a much easier time to be able to optimize their health. But 22 years ago, we lacked the information and we lacked the infrastructure until several years ago when all of it began to come together. Not only technology, but also the fact that the consumer was very much disenchanted with the current system to the point that they were going outside of the healthcare system to get their answers. And the real push came in when we had the pandemic. But just to give context to where we are today, with doctors, and the real issue is that doctors are losing their autonomy. loss of purpose, loss of, job satisfaction, with all the types of restrictions that are happening, because of all the other institutions, governing institutions. And now you have at least 70% of doctors are part of an institution. But back in the 1960s, most doctors were in private practice and able to determine the culture and the type of medicine and healing that they were able to do. In fact, prior to that, in the 1950s, doctors took a very central role in everybody's lives. In fact, the doctors were mostly revered. They were the most respected and the most trusted individuals in society, such that, families would go to the doctors and see the doctors as the judge, the juror, the attorney, the real estate guy, advisor in all aspects, because not only did they have the education, they had the intelligence, but they also had the empathy and the compassion for others and sought to serve them in the best possible way. All of that's changed now. And so the other parts that are challenging for doctors is simply the fact that they're overburdened with so many issues that are not even directly related to the delivery of care. And so that's administration, EHR, which is the medical record keeping, IT, and they're constantly changing, IT devices and IT technology. And there's a major redundancy in what doctors are now able to do, simply because they have to constantly upgrade, and then the time commitments to upgrade their technologies and so many other things. And also the issue with insurance companies and false claims, and actually nowadays, alarmingly, punitive actions or sanctions that are completely inappropriate. And I know that for a fact, because I've experienced it myself, because of the changes of the culture and the fact that doctors are losing that respect, and they've become a lot more marginal. Interesting enough, in the past, doctors were so revered. You go in the cafeteria and everybody would make way for the doctors. Now it's the administration that kind of bypasses them and completely disregards the doctors. And this is a fact that's current today. The other part that's really a challenge is the decreasing reimbursements, combined with, costs of doing business, not well equipped to run the business. We all laugh at doctors because they're, pretty crappy business people, with some exceptions, of course, that understand that, there's so many opportunities for investing. So a lot of doctors invest in real estate, but most doctors just don't know how to run the practice. In fact, most doctors don't even understand how their patients actually make their decisions. And the other part is that, many docs think that their colleagues are actually their competition, when in reality, the people that they should be able to rely on most. In our training, we get to consider our colleagues as our competitors, and so we don't like to work with them. And I speak that in general terms, not including myself, but this is what I've experienced overall. And then, of course, doctors are not familiar with the revenue models that are available to them. And of course, the inability, lack of awareness of any of the current trends. And what's interesting in the current trends that we have today is that at least 50% of the American population, our adult population, it wants to be healthy. They just don't know where to go to. And the whole wellness industry has blossomed in a massive way, such that in the U.S. market, it's at least $1.5, $1.6 trillion globally. It's over $4 trillion, and it's projected to increase by at least 9%, 9 to 10% every single year. Wow. So why is all of this relevant? My mission is to help doctors out there with new tools and resources so that they can get a leg up, so that they can help with the bottom line in a massive way by getting access to the right people. And the right people are my guests here today, because they're going to impart different types of resources, insights, intelligence, and wisdom, as well as other, opportunities to help them develop a business of medicine. And really getting back in the seat, or in the driver's seat of the business, which is why I also have what's called a masterclass fuel, helping doctors reimagine the business of medicine, or just getting back in the driver's seat at their practice. So it gives me great pleasure to be introducing three amazing speakers today. Two of them are present, and we will have each of them present for about 12 minutes each in regards to their specific specialty. I'll introduce each and every one, followed by which, the end of that, a call to action, something that we are inviting you to engage with, and then we'll complete it with questions, answers at the very, very end. So if you have questions, please hold up till the end so that each of the speakers has an opportunity to speak. And my first speaker is a dear friend of mine, and his name is Justin Rice. Justin Rice is an amazing human being that I've had the privilege to be connected with Sean Callaghy and his Unblinded group. I've learned so many great things about him and his capacity to understand value and articulate that value that has to help doctors attain the kind of wealth that they want. Because one of the things that I know is that doctors don't have the bandwidth. They are oftentimes too quick to assume that somebody is trustworthy and then end up going down the wrong rabbit hole. But someone with the highest integrity and the ability to help doctors understand where that wealth opportunities are, that is Justin Rice. And so please welcome Justin Rice and take it over for the next 12, 15 minutes. Just
Dr. Bart, thank you so much for that wonderful introduction. And what you're doing, what you're putting together for physicians, for doctors is so widely needed, not only for the physicians themselves, but for the community as a whole. And so this is just the beginning of what we're putting together. So thank you for doing this, organizing, for leading, and so honored to be here today. And what I'm looking at today is, what is a scientist? As a physician, as a doctor, do you identify yourself as a scientist? Because me as a financial planner, I still do identify myself as a scientist being a seeker of truth, consistently looking for the truth out there of how to heal, of how to make the world better. It is November 11th, 2013, and I'm sitting at my desk in the medical education building of Robert Wood Johnson Hospital in New Brunswick, New Jersey. And I'm there working towards my PhD in biomedical engineering. That particular day, working on my PhD proposal, looking at intervertebral disc of the spine and different scaffolding mechanisms to help with the regenerative medicine of that spine itself. But that day, I was not working on my proposal, as I probably should have. I, however, had something else on my screen. And it was about to cost me 2 months of my salary at the time. And no, it was not an engagement ring. I'd just been married the month prior. But it was, in fact, the coursework for the Certified Financial Planner exam. Now, how did it become that a PhD student in biomedical engineering would be changing his path to be taking the coursework for the Certified Financial Planner exam? That's a longer story. But looking at that story, growing up, personal finance was something that I was always interested in. I just had a natural gravitation toward it. And so it was normal for me to want to make sense of money, to be able to manage money, look for ways to multiply and invest that money for the future. And I had the worldview assumption that everybody did that. Clearly, that's not the case. Clearly, there's people that need help with that. And it took me until I was in my PhD program to discover that. Now, in my PhD program, I was working very closely with orthopedic surgeons, with some OBGYNs, and we started to have these discussions about money, finances, the future. And they didn't really have as much knowledge as I did. And I started to teach and coach them. And as soon as I realized that this was not a popular thing to be as widely knowledgeable in personal finance as I was at the time, and also there was a career then to help people do it, that's when I started to make the shift. And that's what drove me back in November of 2013 to sign up for the CFP exam. I studied for over a year and a half. Eventually in March of 2015, I passed the CFP. In May of that year, got my master's from Rutgers. And that was the jumping point there where I entered into the career as a financial planner. And it made sense that the reason that I was becoming a financial planner was talking with my, the resident physicians at the time, that those would be my clients. And so I started to do different residency seminars, working with physicians from, starting residency all the way through retirement in every facet, and really grew a liking to, helping you guys. And so there's a couple things that I want to leave you with. Today, I obviously can't cover and teach you everything there is to know about financial planning in 12 minutes, but I did want to give you some tangible takeaways from that. And the first one that I wanted to embed in you is, if you can learn medicine, then you can learn money. A lot of doctors get intimidated by the discussion of money and just say, I've didn't train in that. I, will abdicate that to my various advisors. And, you definitely want to have various advisors, but you also want to maintain a level of knowledge and a level of control over your finances. Because if you don't, that's where things get out of hand. That's where scams happen. That's where you get, talked into not good investments, where you end up losing all of your money. And so having that layer of knowledge and that confidence that you can learn this, that you can gain more information about money. And that's where the foundation starts in any of your planning. Because money, when you boil down to it, is incredibly simple at the end of the day. People can make it way more complex than it needs to be, but I'm going to try to simplify it. And as my wonderful coach Sean Calley likes to say, an Albert Einstein quote, making things as simple as possible, but not simpler. And so with money, there's only 3 things that you need to do with money. The first is to make it. The second, manage it. And the third, multiply it. That's it. Make money. Now, as physicians, you've got a leg up on the average American. Now, it didn't come without cost of extended training, of more cost of school, student debt, but all of that leads to at least 4 times the average income of the median household in America. And so physicians on average are earning more money. Now, there's definitely headwinds to that. Insurance companies aren't being favorable. Medicare reducing their reimbursements and making it harder for physicians to operate. And so, you need to get more innovative in order to continue to make the money you're making. But you boil it down to it, you're making more money on average than the average American. So typically, that's not going to be what most physicians have an issue with. Now, it's always good to make more, and that's why it's good to have relationships with Dr. Bart and all the other guests today. But that's not really my primary focus. The second thing that you need to do with money is to manage it. And I'm going to say a curse word for a second, the B word, budget. Nobody likes to hear that word. And in fact, I hate that word. I despise that word. And I don't budget myself. And it would be silly for me to say, you need to do a budget in order to manage your money. But what you do need to do instead of a budget, not doing a budget, is to allocate savings first. Meaning when money comes in to your world, what do you do with that money? Typically, when money comes in, people automatically have things to spend it on. They've got their house payment, they've got the car payment, they've got the student loan payment, they've got this payment over here, they've got to go buy this, do that. And by the time they get to the end of the month, everything is gone, nothing left to save. And so instead of waiting until the end to save, flip it on its head. You want to allocate towards your savings first, towards your long-term goals first. And once you've identified those long-term goals, you want to be able to set money aside strategically for that before you even see it and get a chance to spend it. And the beauty of this is that once you set it aside, getting it out of sight, out of mind towards long-term investments, you have the ability and the permission to spend the rest. And so you don't even need to worry about, what portions of your budget is going to what, as long as you don't tap into those long-term savings after you've already allocated towards them, then you've got the ability to be able to spend however you'd like without restriction. The third is multiply. And multiply, if we just take those savings and we just leave them in the bank or under the mattress, that's not going to be a successful strategy long-term. You're going to lose out to inflation. You're going to
miss tremendous amounts of opportunity. And so there has to be a mechanism to be able to multiply your money so that you can then eventually not have to rely on your earned income. And so all of these three things are absolutely essential, except for, ironically, the making of money. Because once you've built a big enough money machine and you have enough assets to then support your lifestyle, the making of the money becomes irrelevant at that time. So you needed to start the engine. But then once the engine is started, then you no longer need that component. You can enter into early retirement, do other things with your time, or look to make a greater impact in the world, like Dr. Bart is doing. And so in looking at all of those three components, and if you have any questions about this, we'll look and take them later. One of the biggest things that we help physicians out with tangibly, because some of this stuff takes time. I mean, if you have an investment that's supposed to be long-term, we're not looking for those short-term results. If you're looking for a microwave, look someplace else. We sell crock pots here. But one of the most tangible, immediate impacts that we can help physicians with is taxes. Now, the tax code is incredibly long. It is about 80,000 words, which, if you do the calculation, is about 3.2 Bibles long. And so if you're looking at the text of the Bible, and if you've never read that, imagine trying to read over three times that. But that's just the tax code itself. What if you add in all of the different regulations that are within the tax code? That balloons from 3 Bibles to 16 Bibles. And so it would be silly for even myself or you or a CPA to say that they know everything. And that's why partnering with multiple advisors that are going to be, your tax strategist, your accountant, your financial planner, your insurance provider, all of those things working together comprehensively for you, with you still staying in control in the driver's seat, is so critically important. But the tax strategy that we talk about is, number one, doing a financial autopsy, looking at prior year's returns, seeing what actually happened, educating you on what happened, and then looking to make strategic moves in 2024, this year, while we still have time to plan, so that we can reduce that tax bill next year. And so there's going to be various free bonuses at the end of this that we want to make sure to provide absolute value to you. And so one of those free bonuses is going to be tax assessment that we'll get into later on at that time. Dr. Bart, I don't know how I did on timing there, but I'm going to throw it back over to you, and we'll look to proceed to the next speaker.
Absolutely perfect. And one of the things is that a lot of us have challenges, with money, and it's, how we grew up. It's the programming that we have. And the truth of the matter is, it's an important aspect of our lives in our ability to be able to serve others at the highest level. When you have the financial freedom, you actually are able to do a lot more. And so whatever challenge you have, it's always best to find the right advisor to help you. And what I've always learned is it's not so much as to how much money you make, it's actually how much money you get to save. And so again, exactly what Justin was saying. So I'd like to go to our second guest. As with all things in medicine and business, it's a matter of, how do we, what are the processes within the business itself? How are they actually optimized? It's a key component. Once again, the doctors assume that they have all the intelligence and the wherewithal and the abilities to do all the things, and oftentimes will abdicate all these other roles to other people that don't necessarily have the aptitude, the abilities, the experience, and the skill set to be able to actually do any of that. And so the key here is that having the experts who understand the intricacies of the operations. That is Jesse Ariavi, leading physicians and healthcare administrators through trends and challenges impacting reimbursement, physician-patient relationships, and the new practice of medicine. And it gives me great pleasure to be introducing Jesse. I met her through the process of Unblinded with Sean Calicky. She joined me on one of my shows, and very grateful that she is here today, because once again, the purpose of this webinar, as a first in the series of many webinars, is bringing to doctors all types of tools and resources and people that could absolutely help them get a leg up in their business and have the autonomy that they all desire, so that they actually feel that they're in control, they have purpose, and they're able to do the things that they want to do in business. So Jesse, welcome, and the floor is yours for the next 12 or 15 minutes. Are you there, Jesse? Let me see.
Can you hear me? Hi.
Yeah, we can hear you, Jesse. Go ahead.
Let me see. Can you see me?
We can see you.
Hi. Good afternoon. I'm happy to be here. Thank you, Dr. Rademaker, for this opportunity. I loved listening to the first speaker. I think they're excellent points. And I'm a healthcare consultant, just like Dr. Rademaker stated. And currently, I'm an instructor at the Private MD Academy. And we are focusing in transforming practice ownership in modern healthcare. Like Dr. Rademaker said, we are at crossroads right now. There's a lot of things going on in the healthcare industry. We're going through a seismic shift, and there are things that are changing faster than we can learn them, faster than we can train our staff. So as physicians, you've dedicated yourselves to providing exceptional patient care. But like I said, in today's rapidly evolving landscape, we have things that are just coming at us, and we need to know not only how to choose what's going to help our practice grow and be profitable, also what's going to mix in with our team, and how we're going to integrate that with the patients, how we're going to collaborate with payers. There's a lot that goes into practice ownership. We have shifting reimbursement models. I'm going to go through my notes here. Shifting reimbursement models to technological implementation that demand us to rethink our approach to practice management. So I'd like to share some insights on how we can transform these challenges into opportunities, not just to sustain the practice, but also to thrive in this new era. We have, like I said, we're going through changes. We have value-based care models that's replacing traditional fee-for-service structures, which many physicians today are accustomed to, and that's all they know. That's changing faster than you anticipate. Patient expectations are also evolving with a growing demand for transparency, convenience, personalized experiences, depending on what your practice is going to offer. And meanwhile, technology is reshaping every aspect of healthcare delivery and the patient experience. So these changes, they scare a lot of physicians. They scare physicians that are just starting. They have just doubts on opening up a practice, just thinking about all these things. And it also scares physicians that are practice owners well into their career. They are afraid of just being stuck, of being stagnant, not growing, not evolving, and not going with today's modern flow of patient engagement, reimbursement, and revenue growth for a practice. These changes, while daunting, they do present a unique opportunity. For example, telemedicine. Initially, it was seen as a stopgap during COVID, during the pandemic, but now it's grown to a $25 billion industry. It's projected, I believe, to reach 55 billion by 2026, 2025. Or take patient engagement technologies. Practices leveraging these tools are seeing up to 60% increase in patient satisfaction scores, directly impacting their bottom line. So basically what this is saying, that telemedicine is another revenue stream. It's just one of the revenue streams that it's easy to implement, it's easy to train, and it's an extra stream of revenue for your practice. Then we have revenue challenges. Recently, I was reading a report, and it revealed that 81% of physicians believe that they lack the business knowledge to optimize their practice's financial health. This gap is reflected in the numbers. Despite increasing patient volumes, average physician net income has remained stagnant over the past decade when adjusted for inflation, which I believe is something that Dr. Rademaker was speaking about. But there is hope. Whether you are, I am all for practice ownership. I believe that there should be an option for physicians to be able not just to run and own their practices, but to thrive in them. So practices that have adopted strategic revenue optimization techniques, they are seeing remarkable results. And they are combining that with technology, with patient engagement, with collaborations. It's a wonderful thing. I have some numbers and data. I don't know if you want me to go over those. Yeah. Okay. And I had a presentation, excuse me, but I wasn't able to save it because I was doing it myself. And
All good. All good.
Yeah. Okay, so a surgical group in California, they implemented data-driven billing practices. Their practice, they saw 35% increase in collections within 6 months. There was an orthopedic clinic also there in Texas, and they leveraged patient financing options. And that resulted in a 40% reduction in accounts receivable and improved cash flow. There was a family practice in New York, and they used predictive analysis to optimize scheduling, leading to a 25% increase in patient volume without added stress. It was literally just optimizing the schedule. So these aren't isolated cases. They represent a shift in mindset, one that views practice ownership not just as a clinical endeavor, but as a dynamic business opportunity. And this brings me to my mission at the Private MD Academy. We believe that to excel in today's healthcare environment, physicians need more than just medical expertise. They need to be skilled practice owners, astute financial managers, and innovative leaders. We're not just consulting on one avenue of expertise. We like to just see the practice as a whole, and it's the physician, it's the practice, it's the team, it's the offers. And we take all that and we meticulously craft a program just to see what your practice needs are. So there are specific needs. No, are you okay, Dr. Rademaker? No, no practice is alike. You all know that every practice is as different as every color. So depending on what you're going through or what you want to do or what you want for your future, depends on what programs are going to help you. Let's see. I don't have a lot more here. I have some more data that I can share with you. And let's see. We have a plastic surgeon in Miami. He was struggling to stand out in a competitive market. And through our technology integration and branding modules, he revamped his online presence, created a unique patient journey, and his new patient inquiries have doubled. So he's easily becoming the go-to expert in his field. We had a pediatrician in Minnesota, and she was losing patients to larger urban clinics, which is also a huge problem now. And applying insights from our patient financial experience course, she introduced flexible payment plans and transparent cost estimations. Not only did patients' retention improve by 30%, but she also saw 40% faster payment cycle.
Well, Jesse, no, thank you so much. And your work is just absolutely amazing. And as doctors, we're spending so much time struggling just to make ends meet. Reimbursements and Medicare, dropped another 8.5%, last year in 2013, and I mean 2023, and that's consistently across the board over the last 20 years or so. And so it's incumbent upon us as practitioners, as business owners, to actually learn how to run the business of the business and become a business owner versus a business operator. And that also requires the intelligence and the support from people like you to understand specifically how to streamline, operations, where are the leakages, where are the gaps. But in addition to that, and also the purpose of this webinar is other types of revenue solutions. And the reality is that as much as we like to bring in new revenue opportunities, if the fundamentals are not in place, then that becomes a problem. And so part of my objective has been over the last 4 years to develop a program to help docs understand what are those fundamentals, the things that we think that we know, but we actually don't. And if we're honest with ourselves, we don't know them. And we have to subjugate our ego to allow other people to let us know what is real. And that's also on a more granular level what Jesse is able to do for us is, what are those specific systems? And so there are programs that we are making available after this webinar that we can also discuss what each of my guests, the speakers, are talking about. So my next speaker, let me just share the screen here. Let's see if we get this right again. So that is John Baxter. He's the CEO and founder of Baxter Technologies, offering innovative medical energy technologies to restore balance and cellular function in the body. Now, unfortunately, he was not able to make it today, but talking about new paradigms. And so, whilst Jesse's offering a lot of, obvious business, intelligence, as Justin is also introducing us, financial intelligence, there are many new paradigms. And I have two guests today, by the way, that I'll allow them to speak very, very briefly about what it is that they do. And that's Dr. K, and that's also Sam Francis, about some of the opportunities that they have available. But the truth of the matter is that what I like to say is that in today's world, in today's medicine, we no longer have an excuse to be sick. And this oftentimes will trigger people. They get upset. But the narrative, the messaging, the conversations that are needing to have is a mission of mine to change. As I would like to say, I'm lovingly disrupting the current healthcare model and delivering a democratized and unified model where every stakeholder has a seat at the table and wins. And what that really means, or translated, is to make it ridiculously easy for anyone to optimize their health by having access to information, tools, resources of people, and making it affordable. And that is the reason, again, to have people like Justin and Jesse, on this platform to help the providers get access to that information that's also affordable and that they can thrive. But the new paradigms are very, very interesting because technologies are advancing at a rapid rate. And whilst doctors are, very much into the myopic view of their specialty, many individuals outside of conventional medicine have been eclipsing what we can do as physicians. And it's the relevant truth. It's just being honest. Conventional medicine has a very important place in our world today. But the reality is there are a lot of other opportunities and technologies that doctors will be able to access or can access now. But more importantly, it's also what the consumer is demanding. And the challenge is that consumers are now bypassing their own doctors because the doctors don't have a clue as to what's available out there. And so I'm going to briefly talk about the bioenergy technologies, after which I'd love to invite, Dr. K just for a couple of minutes to share what he has. He's got some exceptional technologies out there. And then Sam as well as some innovative opportunities to build their business. But it's wellness at home. And it's a new concept, gaining a lot of traction in today's world. But think of it this way. It's the convenience, it's the affordability, but also the fact that it's the responsibility. And these are, again, items of conversations that I like to have with individuals. So here's John. He actually started off in the mattress business,
but he's been incredibly innovative in incorporating and stacking different types of technologies, because when you think about it, where do you spend most of your time, in your life? Then that's sleeping, or at least some of us do, at least 8 hours if you're doing it the right way. And the truth of the matter is he's developed an anti-aging bed, which is a grounding mat combined with other technologies, which is infrared and frequency that can be applied to these mats. Here's an example of one of those mats. And when we understand frequency medicine, which is a very much quickly evolving field today, but it's not a new field. It's been around for ever since Tesla really identified many of these things, but now finally coming to light once again, because these entrepreneurs are deciding to invest their time and money into developing these technologies. The challenge that I find with some of these technologies is, interestingly, is that it's like with anything nowadays. People like shiny objects. It's sort of also what Justin alluded to earlier. Somebody's convincing enough, and you buy something, but it's absolutely useless for you. People are spending way too much money on things that don't work for them. Not that they're necessarily bad devices or technologies, but they're certainly not used properly or not applicable to the individual. And so one of the things that is important, and Dr. K will describe one of his devices, but it's the diagnostics. And that's part of the main message that I give to my colleagues out there in my masterclass program is we've got to start off with diagnostics. We've got to get the data, because without the data, without understanding what really root cause is, we're very, very much lost. And that becomes a real problem. And so there are different types of technologies. I'm actually working with 3 of them. Hopefully I'll be working with Dr. K at some point with his technologies. But they are complementary, giving us tons of information about the functionality of cells at a cellular and a granular level versus just relying on vitamin levels or micronutrient levels that really don't tell us very, very much. And then you have all these other bioenergy devices. They're photobiomodulation devices. They're, everybody's familiar with the infrared lights. You got these Tesla multi-wave oscillator round devices that apparently are instrumental in dealing with cancer. And you may kind of start thinking, well, is this really anything real? Well, if Star Trek is any relevant in anybody's world, we saw how many of those devices were absolutely therapeutic. And that is the truth. These devices can be therapeutic when used in the appropriate manner. But in today's world, in the biohacking world, people are learning how to stack different types of modalities. And the way that I approach it, for my colleagues out there, is how to implement, how to incorporate different technologies in a very simplified and affordable way, but also how to get it out to the consumer. So these are devices that Baxter has. This is a device that has at least 200 different frequencies, and their frequencies attuned to the different frequencies of functionality of cells that, with enough amplitude and energy and time, can actually help restore, out of balance frequencies. And this is all scientifically based. It's proven. In fact, I had my own experience recently where I was undergoing very specific diagnostic diagnostic systems, undergoing the treatment with the one you just saw, and it actually rebalanced my heart rate within about 30 minutes. It's just super cool. Plasma light, these are different types of frequencies. People may be familiar with the unified EES system. And it's interesting how all these companies are competing with each other and claiming all sorts of things. But the pricing is insane. And there's one unit that costs like 15 grand, and you're supposed to have about 4 of these units. So very quickly you're up to 100 grand. And does it really work? I don't know. But then you have devices like this one that claim to be able to do a similar thing for a fraction of the price. What I like what John has done is he's really looked at how to incorporate different technologies all at the same time. So he started off with this hyperbaric chamber, but he turned it into this, which is what he calls a Tesla medbed. And he stacks about 5 different technologies all at once. And now we're going to begin doing some scientific research, evidence-based research on, how it's affecting different modalities. Empirical evidence says that a lot of people have done really well in a variety of different fields. Obviously, they can't make any claims, but the truth is in how people are improving over time. And then we're looking at different devices that purify water, adding hydrogen to the water, alkalinizing it. And again, a lot of people are coming out with all these interesting devices. Some of them are absolutely applicable regardless of any diagnostic, but still, most of the time we need to get these diagnostics. And so it is a new paradigm. The paradigm is basically looking at, the first, the diagnostics, the data, understanding it, tapping into bioenergy technologies. Clearly, a lot of individuals or medical practices are bringing in IV therapy, peptide therapy. Unfortunately, nowadays with peptide therapy, the FDA is shutting down the access to many of these great peptides that are naturally occurring in our bodies. I can't really quite figure out where we're going to go with any of this. It's unfortunate because it does impact a major punch. The benefit with many of these other technologies is that they're outside the purview of the medical institutions, and so they're considered wellness products without making any very of the specific claims. But there's opportunities there, and then obviously another opportunity for all docs out there. If we are going to reinvent and reimagine the business of medicine, not only getting the fundamentals, with wealth management and processes, but also the fundamentals of how to run a practice. What is a team? What is a culture? How do you actually implement very specific, acceleration, practices like what Jay Abraham teaches us, things like that. I'm going to wrap it up here. Before we go to a Q&A, just briefly inviting Dr. K, just briefly who you are, what you do, and what kind of device that you have. I extend this invitation specifically for individuals like you, because this is about sharing information and us making me making the right connections with the right individuals, as you will find out with the offer that I have after we hear from Sam. So Dr. K, just briefly what you have, if you like to share, that's entirely up to you.
Absolutely. I think we have to realize that there is the number one cause of preventable disease in this country is diet and lifestyle. Our healthcare system, as you said, is broken, and physicians are having a tough time making ends meet. And I tell physicians all the time about health and wellness is booming at this point, and it's going to boom even more within the next year. It's a $60 billion industry in the U.S. And what I found after being in practice for 34 years, I had my own spinal rehab and spinal trauma clinic. I'm certified in spinal trauma. And I ended up hurting myself to the point where I couldn't practice anymore. I was seeing 100 patients a day. If you can imagine, they did that for years. I loved it. But I found out about this technology. It's called a biophotonic scanner. I did about a year and a half ago. And I happen to have the latest scanner with me. This is what it looks like. And non-invasively, we can tell you in 30 seconds if you have cellular wellness or not and absorbability of nutrients. The scanner was actually funded in research by the National Institutes of Health with the Biooptical Medical Department at the University of Utah. They were looking at the concentration of carotenoids in the eye of macular degeneration patients, age-related macular. And they realized that the carotenoids are everything when it comes to the cellular structure. And Dr. Richard Cutler, who used to be the director of the National Institutes of Cancer, said the amount of carotenoid antioxidants you have in your body are directly proportionate to your lifespan. So we need to know if nutrients are absorbing. We have 110 peer-reviewed studies that validate the technology. We're the only nutrition company listed in the physician's desk reference because we do all clinical, double-blind, placebo testing on all of the products. And the reason we do that is doctors want data. We've done 27 million scans so far, and we can tell doctors how to treat their patients with nutraceuticals that actually are guaranteed to work. Because you and I both know that it's an industry that probably 95 to 97% of the nutraceuticals out there, or the supplements, I should say, do not absorb at a cellular level. And we can prove that it's do.
Yeah,
and it's guaranteed.
I think what you have is really, really important. And I thank you so much for that share. And again, it's the data that we can acquire to understand the functionality of cells at a very, very deep level. And certainly, if anybody would like to make that connection with you, I'll definitely make that happen. I think what you have is amazing. Just being respectful for time and everybody's time, just want to give Sam just a couple of minutes here. I know you've got some interesting opportunities. And there's my buddy, Dr. Haas out there. So, if you're not listening, you want to listen to Sam, because he might actually have a cute opportunity for you as well. Sam, just 2 minutes. We can keep it brief.
Yep,
and then I have one other person, that's Dr. Linares. Just I want him to share what he's got, and then we'll go into the Q&A. Sam.
Yep, thank you. Right, and we're all on the same page, right? The health is a new wealth out there. So what we've done, and again, the fundamentals that you were talking about, Dr. Bart, if that is done right, the practice can go and grow like crazy. And what we've done, I purchased a diagnostic company. So instead of taking your personal injury patients or regenerative medicine patients and outsourcing them for an MRI, we're able to bring those diagnostics in-house to the clinic, and you'll never have to outsource your patients, again, for the cervical and the lumbar. And right now, we've been averaging anywhere between $50,000 to $500,000 a month in net revenue for clinics that were actually outsourcing this kind of revenue from their clinics. So now they're able to give their patients the accurate diagnosis they need, and then the proper treatment, and give them something an X-ray and an MRI cannot provide them. We were on the Today Show called The Technology of the Future. So we're really excited to bring our VMA out there in the personal injury space and for regenerative medicine. We just added another 2 more NFL players that have used this, and we're about to launch in Beverly Hills. So you're going to see a couple of celebrities that are going to be using this as well. So if you're a clinic and you're outsourcing a lot of MRIs, that's revenue that you do not get to keep. More than happy to show you what we got and see if we can be of value to your clinic.
Awesome. Thank you, Sam. I'm just going to share a screen right now before we go into the Q&A. And I see this other handsome dude there, I know him well, Dr. Weisberg. I'll have him share a couple of things. But the whole purpose of this webinar, again, is to give doctors tools or resources. I see a lot of programs out there that people are promoting, and I just find them, no judgment necessarily upon them, but it's very singular in the opportunity for the people putting out those programs, when in reality, it's not a complete approach. And that's why I call it the unified health simplified. How do we simplify unified health in every aspect of what health is, from the practitioner to the consumer and everybody in between? And that's exactly my mission and vision, to be able to make that super easy for all of them. And so one of the things that we're offering with this webinar is take advantage of a business acceleration. There's a QR code. You can register right away. You'll get some additional bonus material with the first 5 that sign up. And then the whole entire value is about, 12 grand. And so I really appreciate, Justin and Jesse for, providing this opportunity for those that want it. Definitely what they have to offer is instrumental in so many different levels. And so I'll be showing the screen, once again afterwards. But before we just go into a brief Q&A, Dr. Linares, I know you got an amazing product that I think doctors need to be aware of. And for sure, just really briefly, like a minute or so, tell us what that is. And then I'm happy to make those connections as well. Are you muted? I think you're still muted.
Yeah. All right. Good afternoon, everybody. I just finished my daily routine here in the office. And as Dr. Rademaker was saying, we know each other for a long time. And I'm a pulmonologist interested in all the different aspects of oxygen biology, metabolism. Came across one of the elements that you showed there for hydrogenated water. So with a group of engineers, we created a mechanism by which we not only hydrogenate the water, but we also hyperoxygenate the water, because the main problem in the water in the world is that it has poor levels of oxygen. So right now I have the product which is We call it, high ox super water. It's a bottled water, oxygenated, and different than other waters that you see that, open and drink it within 30 seconds, within 5 minutes. Our water, oxygen, and hydrogen contents last for up to a month to 2 months. So we have developed not only this, but also the devices for agriculture, improving organic agriculture, also bioremediation of contaminated lakes and reclaimed waters from the water treatment sewage plants. So we have seen how this has improved, people similar to the hyperbaric oxygen chamber, healing chronic ulcers, diabetic ulcers, some people with eczema, psoriasis, and of course, I, being a pulmonologist, and my patients who have COPD, pulmonary fibrosis, asthma, and sleep apnea, when they use the machine, they put the water and we have had, awesome results. So it is out there, it's in the internet, and soon probably coming to a supermarket near you.
Awesome. One of the things that's very, very clear, and again, as physicians and many consumers forget about this, is our oxygenation levels. And it's not just that oxygen level, but it's also our oxygen consumption. And it's interesting how, as educated and sophisticated we are as doctors, how many things we've actually missed and completely ignoring. And again, I get it. As doctors, we're working really hard with the onslaught of information and the demands and obligations, and it's a tough world. And so, being in the coaching business, personal development business, and that peak performance business for the last 22 years, is a great honor for me to help my colleagues out there do a better job. Because at the end of the day, if our communities are healthy, we're also a lot more wealthy. I'd like to give my dear friend Vern just a brief moment as to what he does. I will understate his talent as a coach. He's much more than a coach, a business coach. He's written a book, an amazing plastic surgeon, no longer practicing, unfortunately. So a lot of people are going to be very unhappy that he's no longer an amazing plastic surgeon in practice. But just briefly, what services do you offer doctors so that people can also get connected with you as I make that happen? I think you're muted. Yeah, you're good. You're not muted, but we can't hear you.
Yeah, I had to move things over for something.
There you go.
Can you hear me now?
Yeah, we can hear you.
Good. Yeah, I had no idea you'd be calling on me, Professor.
But I'm going to limit you to about a minute and a half because I know
I'm going to try to make it less than that.
Okay.
So essentially, what I'm doing now is I'm focused on personal and business financial health for everybody, but especially for physicians, because as Justin was pointing out, and Justin and I are friends, the problem for physicians is we do have a tendency to think that we know more than we do, to think that we're better judges of character than we are. And because we maybe don't want to sit down and, I guess, learn what we need to learn to protect ourselves and understand how money works, we fall prey. And so my mission in life is to help people to really start to understand the basics of finance and personal finance, and along those lines of what Justin was explaining, how to get that sort of plan started, to help implement that plan and protect them and their families, but also at the same time be able to maybe access some of the some of the equity out of their practice and have it grow and serve as a source for them to be able to have some financing should they want to get, like hydrogenated water products, etc. Those sorts of things that they want to add without having to go through some of the processes and problems of attaining that financing. And also, for me, what I ideally want to do, and I know I'm going farther because you got me started, is really help physicians earlier on, because the earlier you start, the more powerful all of the strategies are going to be. For those of us who come about learning stuff later, still
Right.
good, but not as powerful.
Well, I want to thank you for that, Dr. Weisberg, and just so I'm really, really clear, what Justin and Vern offer are completely different approaches to what it is, and really want to clarify that, and that's where I actually come in, so that.
But we are philosophically aligned.
Yeah, I get that, but I just want to be really clear that the purpose of this webinar is to really help you, the listener, whether you're on this live event or afterwards, to connect with me so that we can schedule a business acceleration session in which I identify with you, where the leakages are, what your mission, vision, purpose is, what your targets are in a very comprehensive way. And I have to thank, Sean Callaghan and the Unblinded team, to helping me to get to this level, because it's so critically important that we support doctors out there. And in fact, any kind of business, the whole Unblinded group is more about medicine. It's about everything. It's empowering people to be the best that they can be so that they can have the best possible integrous impact on the world. And so that's where the opportunity, if you listen to this, after the live event, certainly connect with me, and I'll be able to connect you with the right people to make sure that you get the right kind of resources. So is totally my job. So I'd like to open up if anybody has any particular questions. I'd love to start off with either, Justin or Jesse or myself, whatever questions you might have. Or if there are no questions, then I'll start off with Justin if he wants to add anything else.
Yeah, as you're thinking of questions, one thing I wanted to emphasize, and Dr. Bart, maybe you can throw it back up in terms of the QR code. My portion of the value, there are three key things. If you're interested in learning more, financial acceleration session, where nothing will be sold. It's clearly looking to identify where you are financially, where you want to go, the gap between them, and how you can fill that gap. There's no offer at the end of that to purchase anything, to become a client. It is purely a value-added session for you. The second thing, and then now this is only for the first 5 people for the bonus material, is a tax review. And so what we'll do, and that's, by the way, I typically charge $1,000 for that. Will not charge you guys this, but that tax review will look at a prior year tax return, will identify what happened, and then we'll look at what you can do this year in order to change the trajectory for your 2024 taxes so you can pay the least amount legally as possible in your taxes and understand the taxes like you've never have before. And the third thing is access to our financial planning software, which typically when we do a financial plan, our minimum fee is $3,500 all the way up to $15,000, depending on complexity. And so the minimum fee in the door is $3,500 to get access to that software. It will be yours completely free as well. Again, only for those first 5 people that take action. So I just wanted to emphasize the value of what's being from my end, on top of all the value that Dr. Bart and then Jesse is going to provide as well.
Yeah, and all you need to do is just follow that QR code. There's a registration on there, the name, address, and phone number, and the best time to connect. And the details that Justin just shared with you are listed there, including an analysis, operations analysis by Jesse that she will do as well to really understand, where some of the limitations are. But definitely myself doing the business acceleration session to really understand at a very granular level, where some of the leakages are, where some of the opportunities are, also as Jesse was sharing earlier, but also understanding the wealth. And now we're talking in different terms of wealth, but the wealth of opportunities that are out there in terms of helping people optimize their health. I've been doing a lot of very intensive research with different companies worldwide that allows us to understand, the functionality of cells on many different levels, which includes actually what Dr. K has to offer and how to be able to implement that into the practice, and then bring in other types of revenue models that without much investment at all, how you can grow that. But it's also individualized. It's only if it's appropriate for, your business and your own personal vision. If you want to have that autonomy, you have to step out of conventional medicine. Because truly, I mean, people are using the word rigged, and you see all these terms, flying around, and all these programs out there, which in fact, I mean, they're great, but on their own, they're very, very limited. And so the purpose here is to have an expansive approach, understanding in a unified way how to help you really thrive in the business of medicine. Jesse, did you want to add anything as far as what your operations assessment is, if that's the correct term, that you like to apply, for those first people that sign up? And are you still there?
Hi, yes, I am. Well, I'm offering obviously our collaboration, but I'm also offering a call, like you stated before, an analysis to see if there's anything that I can help you with or develop for your practice. This is a no obligation, no sales call. I actually love to listen to the obstacles and the issues and challenges that you're having, because it makes my job very interesting and exciting. I love to develop plans and just implement strategies and proven methods that will definitely help your practice thrive and grow and move forward.
Yeah, no, thank you for that. And we have a responsibility, now that we have technologies and opportunities to really support doctors. And when I use the term doctors, I'm using it all inclusive as far as all health practitioners, even nurse practitioners, even those chiros out there. And Haas is a very unique individual. He's a specialty in the chiropractic biophysics, which again is the new paradigm of chiropractic, where you are getting the data, you're getting the numbers, you're getting the diagnostics at a much more granular level than to be able to advise your customer, your client, the consumer, how to start doing things at home. And a lot of what's happening in medicine today is a transition to home care, not home healthcare, but home care. And that's where these technologies are extremely beneficial. But it's also democratizing health, and it's also displacing the responsibility where it actually belongs, and that is with the consumer themselves. And so for many, that's still a hard pill to swallow, whether you're the practitioner or the consumer, but that is the future, and it's a good thing. And with the right people, we can make the right things happen. Just want to give it out to anybody else who has any questions. If not, I'll put up the QR code one more time, and then we can wrap it up. Unless, Justin or Jesse, you would like to add anything else. I see Juliana's here. She's getting ready to make a major move. Do you have any questions for our speakers? Great. Wonderful. Well, let's wrap it up. Thank you so much for attending. This is an interesting evolution in my world, and I'll wrap it up by saying this. And I was very fortunate. I grew up in 5 different countries, speak 4 languages. I went to medical school when I was 17 and trained for 17 years. But as soon as I graduated from medical school, I knew there was a major divide between what conventional medicine was teaching us and what the consumer was needing and looking for. And it took me many years. And it wasn't until I fell into the world of personal development and peak performance, something that I didn't know that existed. In fact, it's a fun story, maybe for another day. But I thought that was, hogwash. I mean, why do you need a coach? And, who's going to, I'm a doctor. I'm an intellectual. I speak 4 languages. Who's going to teach me what? And I found out very quickly everything. And even more so with the Sean Kennedy and Blinded group. And how it's absolutely helped me exponentially grow my mission. And that is to lovingly disrupt the current healthcare model. And that doesn't mean displacing it. It means giving doctors and consumers other options that are available out there, that are real, that are believable, and that actually have a lot of peer-reviewed evidence behind them, just like Dr. K was sharing. And it's a matter of re-educating the process of accessing health optimizing. And there's so many different ways that we can do that. That's why I have the masterclass Fuel. That's why I bring experts like this in all fields to unify that process for doctors and consumers. And that is also why I also have what's called the Doctor's Guide podcast, a different show. It's a role play show where people get to get engaged in the process of making the best decisions for themselves, and something that's really very exciting and dear to my heart, and an idea, a paradigm shift, and how to access health that I came up with about 22 years ago. That at the end of this year I will be rolling out. So for all of you, thank you for today. Looking forward to getting any kind of feedback, any questions. By all means, go to my website, drrademaker.com. And I will also post the ways to get a hold of us. Certainly register, and I will definitely connect you with the people that are right for you. Any final words, Justin and Jesse?
Dr. Bart, thank you. Leadership present, your ego subjugation, being able to enter into this space and now teaching others how to do the same. Definitely love what you're doing. Keep it up.
Thank you so much. Jesse, any final words?
Also, I just wanted to thank you for coming up with this innovative and collaborative effort. I think that together and all these professionals that are like-minded, we can bridge many gaps that are inundating this industry at the moment.
No, absolutely. I thank you for that. And as I learned from Tony Robbins himself, the idea of competition frightens a lot of people. But if you go to the roots of the word of competition in Latin or Greek, whatever one it is, it's to collaborate. And so we are all collaborating. And, in this space, we all can win, and we all have our skill sets. We all have our magic. And it's a matter of working together, not against each other, because that way the vibration elevates and everybody is a lot better. So thank you so much. And this concludes this webinar. Thank you. Awesome. Great. Well, thank you, everyone. If anybody wants to offer any feedback, that's fine. This will not be part of the recording. And if you're happy, just sign off and I'll follow up with you individually. Yes. Dr. K.
I wish I would have had a lot of this information when I first went into practice in 1972. It wasn't around and it's not being taught. So this is very, very informative and very important for all docs. I don't care what specialty they're in. They need to have different aspects of how to work with finance and also how to make their practice run more profitably.
No, thank you. Thank you. And I'll definitely invite you on the show as a speaker. So definitely, I don't know about Vern Weisberg. I mean, he's, we have to decide on that. Justin has to prove that for other reasons. Juliana, did you want to share anything?
Very informative. I loved how eclectic the group was. Everybody has just something new and different, but all complementary in some ways. So that was very good. Thank you.
Well, you're very welcome. I see John is out there. We're going to get you on the show too sometime, John.
Yeah, terrific people. A lot of interesting diagnostic stuff, the supplements, the different devices. Totally interested in all of it.
And then you haven't met Dr. Weisberg, have you?
No.
Okay, well, you guys are going to butt heads because, he's the most prominent plastic surgeon telling people how to beautify themselves. And John is the guy that tells everyone not to. So,
I just say to keep away from med spas. I actually had an interview today, and I was like, just go to a good doctor, so that would be fine. He would qualify.
Actually, I'll have to have you and Vern on the same show, and you'll be able to talk back and forth because John is a pretty cool dude.
That'll be fun.
Anyhow, any other comments, Vern or anyone else? Dr. Linares, any feedback, any thoughts? How can you support?
Yes. It was, this has been my first time, although, we have trying to get into conversations for a while, being too busy, but it's very interesting to, find all these different approaches to new modes of health, new modes to promote wellness that are very welcoming for different practitioners. And most of the patients are looking for, and that we can offer it if we can get it, the right approach, the right communication, and the right tools for it. So, I congratulate you for it.
Well, thank you. All right. Does anybody else want to add anything? Justin, any final thoughts?
No, I thought it was great. Thanks for all sticking around, and I had a lot of fun doing it.
All right. Well, thank you. And I'll circle back to you, Justin. Well, again, thank you so much. Really appreciate you. This is the inaugural show of this webinar. And once again, I want to thank the Unblinded group to getting me into the space. Really appreciate you, Justin, for stepping up and giving me the guidance as well. Without your help, this wouldn't have been as successful as it was today. And then Jesse, thank you for having the courage of stepping up in this format as well. It's a new format for you. And I look forward to including everybody in future shows, because every time it's going to be different. And certainly, if you've been a speaker before or you haven't, there's still that opportunity for me to highlight you briefly like I did today. I think that's important. But once again, it's about how the way that you can help me, by the way, is inviting others to the show, because this is what we need to do. We need to bring others. One of the biggest things that I feel that needs to happen is that as we create an ecosystem of like-minded people, now there's no more important person than the other, but together we can all thrive and shine. And what I love about Sean Callaghy, and that's been also my philosophy, is not to be the highlight of it. It's me desiring to highlight everybody else in this, because that's what it's about. I have a very limited, intelligence in many of these things, but collectively, we have so much, and that's what we need to hear about, because I've made mistakes by trusting the wrong people, and I don't want others to do the same. And with your help, I won't do it as well. So thank you so much. And next one is June 19th, and I'll definitely keep you updated.
All right.
Thank you, and signing
Bye.
off.